I'm Liliane Luwaga. I work with the World Health Organization in Juba, South Sudan. Before, I used to work with the Ministry of Health, Uganda, before I joined the response in Liberia. When we went, the health system was really down, and many of the health workers had kind of quit because they feared the infection. So when we came in, we were like, the kind of the frontliners, and we had to build capacity, encourage others to work with us. And I was mainly addressing the risk communication, community engagement part of the response. That entailed, first of all, understanding what the community's perceptions are regarding the disease, identifying the risks together with the communities, and helping them to take action in terms of behavior change. Because there were many myths about the disease. At one time it was they believed that it was just something foreign, somebody's using that as a ploy to make money. Why should people think like this? Because we have already discussed, and somehow you'd always feel like you're going back. That resistance kept on coming up, and at times you'd feel, we thought we had a breakthrough here, but then you find there's another challenge. Some families lost many people. We had to deal with the stigma, among the survivors. One thing that I have realized, which we are not addressing in here, is the psychosocial support, both to the responders and to the communities. It's an area which I think came on board later, but we should have had it right from before we left our countries. The main lessons, as far as I can see, is that we need to be prepared. We don't have to wait for outbreaks. I would encourage that countries have risk communication plans and strategies which they continuously monitor and implement, not to wait when disaster strikes. So we need to work closely with the communities to promote those interventions which are positive and they are likely to prevent future serious outbreaks, and again work with them to identify strategies to reduce on the impact of some of these risks. This is a good opportunity to share and to learn, and then when another opportunity comes up, we share where we are. So I'm encouraging that this should not be the only conference. We should have regular forums, or they should be a way of sharing experiences.